From music to magnets to acupuncture, get ready to step away from the conventional world of medicine and into the land of alternatives. Welcome to Ask Dr. Manny. When I went to medical school, alternative remedies were not a common practice, even though some have been around for more than 5,000 years. We were taught about the power of pharmaceuticals and the success of surgeries. Today, those treatments are still the most prominent, but times have changed. Some holistic cures are now at the forefront of medicine, and these natural painkillers are available from head to toe. What looks like a high-tech experiment is actually doctors tapping into Jennifer Fox's brainwaves to help her get rid of her migraine headaches.
It gets pretty frustrating because anybody that gets migraines knows that it's not just a headache, and you can't just say to people, oh, my head hurts, I'm going to go lay down, and you're just done for the day.
The 25-year-old began suffering from migraine headaches in middle school. After trying numerous medications, many of which made her headaches worse, Jennifer decided to try another approach, brain music therapy.
I will take this recording and will translate digitally with the help of a very complex algorithm into musical frequencies. Right, so we do create for the patient his or her personalized musical file.
Every patient will get his or her own music recording based on their brainwaves. 2 personalized musical pieces are created. Dr. Mitlin says it is 80 to 85% successful. There are no side effects, and it sounds like a piano.
I listened to it twice through every night before bed, and after the first few weeks I started to notice that I was responding. Right now I really don't get any migraine headaches. I'll get maybe a sinus headache or two that can be environmental or something like that, but no more migraines.
You okay?
Yep. When it comes to your back, acupuncture has been the pain-killing king. But in the alternative world, acupuncture has become fairly mainstream. Some insurance companies even cover it, but the newest trend called cupping is not. This suction device creates a vacuum inside each cup. The cups are then placed on various acupuncture points on the body and either left still or moved around the skin in a massage-like motion.
After my first visit, that was the first night I slept pain-free. And then a little bit of pain started to come back, but then after by my 3rd visit, now I've had no pain.
It makes me anxious.
Tapping along certain pressure points in the body is also creating a buzz. It's called Emotional Freedom Techniques, or EFT.
There are circuits in our body where electricity is passing along and traveling, and that's what we're doing. We're cleaning out this system by doing the tapping. So we don't use needles, but we call it psychological acupressure.
EFT is also used to treat addictions, phobias, and other ailments. If you think it looks strange, so did Carol Look, but concerns over aesthetics went out the window when she started using it on patients.
Client after client said, wow, I feel better. My body feels more relaxed. My neck isn't so stiff. I don't feel like having a cigarette, or whatever their issue was.
Obsessions with handheld devices has generated a new chronic pain problem, BlackBerry thumb.
It's more of like a stinging pain, and it's dull and it lasts a long time. And I've had it for close to a month now.
I can barely move my right thumb, and I was like, I have to do something about it immediately.
Unwilling to go under the knife, David went to see Dr. Stephen Shoshani, who offered up a less invasive procedure.
I mostly use non-surgical approaches. One of the ones that I use a lot for BlackBerry thumb or carpal tunnel syndrome would be the Graston technique, which is a myofascial technique, which helps to smooth out the muscle and take out those fibrous adhesions that build up over time and restrict motion in the hand, wrist, and elbow.
Dr. Shoshani also uses a low-intensity cold laser therapy to zap away pain.
It's basically non-invasive light that helps bring down the inflammation, increase the range of motion, and reduce the pain.
The cold laser draws fresh blood to the area, speeding the healing process. Patients usually feel results after just a few visits. We take thousands of steps every day, and all that walking can take a toll on our tootsies. Studies have shown that using magnets can increase bone healing and decrease inflammation and pain.
It's a very strange sort of feeling. There's sort of this tap, 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 tap on you can feel it in your tissue, and it goes towards sort of the damaged part of the joint.
Pulsed electromagnetic therapy is not FDA approved yet, but patients are praising this method after just a few sessions.
It felt softer and a little bit more flexible.
I actually tried magnetic therapy too, and it can be used in other parts of the body, but it made my tired feet feel a little bit better. When we return, the medicine hunter is fresh from his latest adventure and ready to tell us which foods and herbs will kill your pain naturally. Welcome back to Ask Dr. Manny. We have showed you some alternative therapies that can knock out pain, but there are foods and herbs that can do the same thing naturally. Join me now is Chris Killam, better known as the Medicine Hunter. Chris researches natural remedies all over the world. Hi, Chris.
Manny, it's
how
a
you
pleasure
doing,
to be
babe?
with you.
You and your herbs, you know, it's
More
just
good
you.
stuff to
you
taste.
and your herbs, you know. Listen, we're talking about alternatives. We're talking about foods and herbs, and I know you brought a whole bunch of things that have a lot to do with pain control.
Right.
Okay.
Right.
So I think the first question I want to ask you, because a lot of folks ask me this, why? Why is it that these things help with pain?
Well, some plants contain anti-inflammatory compounds. Many of the antioxidants, we're all familiar with, reducing oxidation in the body. Many of those compounds are also anti-inflammatory. So they actually work in the body like the anti-inflammatory drugs. They suppress the COX-2 enzyme, which is your big inflammation enzyme. And so that helps to relieve pain. And in fairness, most don't do it as quickly or aggressively as the drugs do.
As popping a pill.
Yeah, but they can do it pretty quickly and very well.
Right. All right. So the mechanism is almost the same.
Same mechanism.
That when we take a pill, we find some in the natural products. Okay,
Right.
let's go through the list. I see my favorite.
Ginger root.
Ginger.
Yeah, ginger root.
I'm going to taste every single one of them.
I would hope.
All right, ginger root. Here we go.
Spicy. I don't get any. All right. It's okay. Anyway.
No, I'll give you a piece.
No, it's
no, I'll give you a piece. If I'm, ooh,
yeah, it's
baby.
spicy, huh?
Ooh, baby.
Okay.
Oh yeah, I remember this one. Yeah.
Want me to talk about this?
Yeah. Well, tell me, because I feel the pain coming on.
It contains these compounds called gingerols and shogalls. Okay, they're antioxidant, but they're also powerfully anti-inflammatory. Wow. If you've got like inflammation, if you've got joint pain, of course, sore throat too, which is acute inflammation. If you make a ginger root tea, about a piece the size of a thumb, grate it up, make tea out of it, drink it, that'll help to reduce that pain and inflammation. And especially in the case of sore throat, there's nothing like ginger root.
All right, well, we got that. Turmeric, which is a spice.
It's the yellow spicing curry powder.
I want to put my finger in here.
Yeah, yeah. Well, we had this fresh, remember, at that herb store a while back.
Okay, not too bad.
No. Turmeric is one of the most powerful anti-inflammatory. Yeah, well, okay. But, it's good dirt.
Yeah, good dirt.
It's really good dirt.
Yeah, love the color.
One of the most powerful anti-inflammatory plants in all of nature. It's got a group of compounds called the curcuminoids, and the bottom line is that they're quite concentrated in this root. They significantly reduce inflammation. So if you've got a good high intake of, let's say, yellow curry on a regular basis, or if you just cook with turmeric in soups, stews, veggies, fish, whatever, you can help to reduce inflammation in the body.
And cooking it does not degrade the enzyme properties of
it doesn't. Some compounds like vitamin C are reduced with heat. Some compounds are very stable. The curcuminoids, you could boil them for days. They're not going to be reduced.
All right. The next thing is, I don't know, cat's claw.
Cat's claw. That's this vicious-looking stuff here. Cat's claw is the bark of a vine from the Amazon. And cat's claw is actually, you know, it's a pharmaceutical drug in Austria for the treatment of rheumatoid arthritis. This stuff, to your health.
Somebody give me some Frank Sinatra music. I need some Frank.
My way?
My way.
Delicious, huh?
Well, it
not that
smells
bad.
like, it smells terrible though.
It's woody. It should be. It's the bark.
I
It's
wouldn't
the
call
bark
this
of a vine.
woody smell.
Okay.
Maybe processed wood.
Cat's claw is a very significant anti-inflammatory. I use it to relieve pain from old injuries. I use it regularly.
So if you have a headache, if you have joint pain, if you have a little bit of
Especially
arthritis.
joint pain. And you can get cat's claw, in fairness, people don't have to drink it. This is an extract I have at home, but you can get cat's claw in capsules.
Now, this comes in liquid form, or did you put some powder in it?
This is a liquid extract made for me, but you can also get it in capsules if you just don't want to deal with the taste. At natural food stores, places like Whole Foods, you can get cat's claw extract.
Okay, so that's
we're
that.
Ginger.
Yeah. Now, this I put in my lamb chops all the time.
Rosemary. Rosemary. Profound antioxidant properties, very significant anti-inflammatory activity. Usually people don't eat enough rosemary to get the real anti-inflammatory benefit.
This is a really hard herb to eat.
You can make a tea out of it, though.
Oh, you can make a tea.
And you can also take a bunch of rosemary, blend it up, and put it in different recipes, and you'll get more of the anti-inflammatory power.
Ooh, this is powerful.
And National Institutes of Health has been doing a lot of research into the anti-cancer
I wonder if you could put this in
properties.
salad.
Sure you can.
Sure, a little vinegar.
Chop it up really finely, put it in a vinaigrette. It's good stuff.
All right.
Yeah.
And this has properties also similar.
Yeah, the phenols in it, which are antioxidant, are also very significantly anti-inflammatory. So good pain relievers as well.
All right. We have a juice.
Yeah, now the juice, this is black currant juice. And the good thing about this, it tastes delicious. The purple pigments, the stuff that you get in blueberry, elderberry, blackberries, they are significantly anti-inflammatory. What this will not do, if you've got like pain in your joints, it's not going to relieve it in a half hour.
Okay.
But if you have a daily intake of these purple antioxidants, it'll reduce the overall inflammation that you experience.
High in calories? No, not a lot of sugar.
It's got some sugar in it. Sure, but
sweet.
Good tasting stuff.
Great vodka mixer.
Excellent, excellent. You even have black currant vodkas out there.
There you go. See?
Right.
And I was going to coin the phrase. Not bad.
But so you have, if you have these high antioxidant fruits on a regular basis, you're likely to experience less inflammation. So it's not so much, oh gosh, I'm in pain, I'll drink a glass of black currant juice.
Right.
But just overall as a dietary recommendation.
Okay. Now, you have a whole bunch of creams and capsules, I guess.
Yeah.
Let's just put them all together.
One of my great favorites, Tiger Balm. It's your classic menthol.
You don't think that's more up here? Those creams really, they're...
For pain relief?
Yeah, they're more like psychological, I think.
You know, when I have really sore muscles and I put on Tiger Balm, I get great relief. This is like the Tabasco sauce of pain relievers.
All right.
I see it everywhere.
And it has capsaicin or no?
It has, let's see, what does this have in it? It's actually got camphor and menthol are the two primary, classic pain-relieving agents.
Yeah, but
stuff works. Stuff works great.
All right. And then you have other creams there.
Got capsaicin cream. Now, you know capsaicin cream.
That's hot pepper. Hot pepper. So you taught me that.
Well, there you go.
Yeah.
But you knew that anyway. Doctors recommend capsaicin cream for arthritis pain. Yeah. And the crazy thing is 1/4% of this, that's all, is capsaicin. All the rest is just inert cream. It's sufficient enough that, like, if you got pain in your joints, you put it on, relieves that pain. Got an encapsulated product here called Curamin, super concentrated in turmeric especially. I use it for pain relief for old injuries. I'd say it works about 75%. Right. Good stuff.
Yeah, but let me ask you one last question.
Yeah.
Can you be mixing all of this? Let's say if you can, it's not too much.
Just like you can have broccoli and asparagus in the same meal.
Okay.
You can have ginger and turmeric and rosemary and all of these things in your diet on a regular basis. As Hippocrates said, let your food be thy medicine.
Okay, all right. Well, that's very good. I know now what to do if I want some natural remedies. I'm going to start adding some of this. I have seen some studies on this particular.
It's yours. It's yours.
There you go. See, I get a freebie. All right, Chris, thank you so much for joining us.
Always my pleasure.
You are the man.
Thank you, sir.
Go find more adventures out there in the world and tell me what cures you're coming up with. You can check out the Medicine Hunters blog at foxnewshealth.com. And coming up next, we run down the latest headlines with our very own Dr. Sinara Coomer.
Still ahead on Ask Dr. Manning.
I put my vocal cords to good use with a very special little girl. It's a mostly melodic Manny Plus One.
Believer, I couldn't leave her if I tried.
Welcome back to Ask Dr. Manny, and welcome back my partner in crime, the lovely Dr. Sinara Coomer, here to sort through the medical studies making the headlines. Hi, Dr. C.
Hi, Dr. Manny.
I love the purple.
Thank you. It's fall.
I should have wore a purple
tie.
I should have. Anyway.
We got to talk to the producers.
Yeah. We have a lot of headlines, and today's show is all about alternative therapies and pain control and things like that. So I wanted to kind of focus on the first studies that we're going to look at. This new one that talks about children and who experience frequent, stomach aches, and how they can actually improve their pain by using their imagination. Tell me about this study.
Yeah, this is a great study that's coming out of in the November issue of Pediatrics, and basically it looked at 34 participants that were between the ages of 6 to 15 years old who suffer from functional abdominal pain.
Now, what is that?
That's a type of persistent abdominal pain. They don't really have a cause for it, and generally kids will grow out of it in their teenage years.
So it's not like associated with a disease,
right,
or any kind of GI abnormalities.
Exactly.
Like some frequent stomach belly aches, but really of no source.
Exactly.
Okay.
Exactly right. And what they did is they had 19 of these 34 participants not only undergo standard therapy, but also to undergo this guided imagery therapy, which is very similar to self-hypnosis. What they basically did is they wanted them to imagine themselves doing something that would produce less pain or would stop them from developing the pain. For example, one of the things that they would have them do is pretend that they had, or imagine that they had a shining object in their hand that melted, and then they put it against their bellies. And the light and the warmth of this object would basically protect anything from coming in and hurting their belly.
It's almost like meditation for kids.
Exactly. And they did it twice a week for 20 minutes and every day for 10 minutes. And they actually found that the kids that were doing this guided imagery therapy actually had 3 times more chance of having improvement in their abdominal pain than the kids that didn't.
Yeah.
So it's actually a very good technique. And I sometimes have my patients do this as well. If my post-surgical patients as well, I sort of get them to try to imagine where the pain is less, where they're healed, the scars have decreased, and it seems to work.
My only criticism of the study is that it's very small, 34 patients.
It's a very small study.
And I get it. It's a good thing for kids. All right, let's look at the next one, which is a hotly debated issue. No matter how you slice it, and it has a lot to do with the topic that we've been talking for now weeks here, you and I, childhood vaccinations. Right now we're talking about the swine flu and everything else. So, what do you think about the study that came out that looked at fever-lowering medications can actually lower the immunity from vaccines in children?
Right. This is one of the first major studies that's come out that's actually shown that there was a reduction in the immune response for kids that received Tylenol. Because, like some parents or mothers, fathers, they'll take their kids for their shots, their regular childhood vaccinations. We're talking about polio, mumps and measles,
right.
Tuberculosis, whatever the regular vaccination shots are. Meningitis, and they'll sometimes give them Tylenol either just before they go in for their vaccination or right at the time that they get their vaccination in the hopes of reducing their fever response.
Before they even get it. So it's
kind of
prophylactic.
take it, you're going to go get the shot in an hour. I'm going to give you some, let's say, Tylenol-like medicine.
Right.
And this way, if you get a low-grade fever or discomfort in your arm, it's not going to be as bad.
Right. They'll be less fussy and everything else. And the bottom line is that it actually was shown in this study that it did actually reduce the immune response that the kids had, but when they took the Tylenol as opposed to the kids that didn't take the Tylenol.
What would be the mechanism, though? Why would
the mechanism is that it's blunting a fever response. And when we get a vaccination, we sometimes warn people that we've been talking about with the H1N1 vaccination, you may get a low-grade fever afterwards. And that's your body's natural response to developing antibodies against this virus. So what it's doing is it's sort of inhibiting that fever response, which is actually a good thing when it's controlled and when it's limited, so to speak. So the CDC actually advocates for kids that are high risk for developing seizures actually have the Tylenol prior, because fever can sometimes trigger seizure activity in children. But some doctors are saying, given from the results from this study, although the response is still adequate, it is reduced. So if you can avoid giving them the Tylenol, go ahead and do it, unless they're high risk for seizures.
All right. Over the past couple of years, robotic surgery has become a very popular option when it comes to prostate cancer. It's a less invasive approach. It seems to reduce the side effects that you get. But a new study says maybe not so, because maybe the issues of incontinence and erectile dysfunction are greater in robotic surgery for prostate cancer.
Right. Well, this is a major study, a huge study that came out of the Journal of American Medical Association. And it looked at 9,000 participants between the years of 2003 and 2007. So the whole basis of the study, anyway, just to sort of set the background for it, is that the question is, should patients, if they've been diagnosed with prostate cancer, especially early stage, should they undergo surgery, which has the consequence of erectile dysfunction or incontinence? Or is radiation alone sufficient, or just watchful waiting, and if there's any changes in the prostate, then pushing forward for surgery? So that's still the question that's out there. Should patients be undergoing surgery, and at what stage should they undergo surgery?
So this study really doesn't deal with the ultimate question of what's the best treatment for prostate cancer.
Right, exactly.
It doesn't
deal with that. It really
you still
just
have to figure that out yourself and talk to multiple specialists.
Right. It just really looked at whether or not robotic surgery or the traditional open surgical procedure for removing the prostate is the best one. Yeah. And the results were a little bit surprising, especially for those that are doing robotic prostate surgery. And what they did is they looked at the participants. 1,900 of them had undergone robotic surgery. And of those people, they did stay in the hospital one day less. They did receive less transfusions. They did have less internal scarring. But on the other hand, they were more likely to complain of incontinence or erectile dysfunction within 30 days of surgery, as opposed to the open surgical procedure. And the difference was 5% of patients with robotic surgery versus the 2% with the open surgical procedure.
All right, so what would you tell me? Let's say I, God forbid, develop prostate cancer.
Right.
You're my partner in crime. I said so myself at the beginning of the show. And I wanted to have surgery because I didn't want to keep my cancer.
Right.
What would you tell me to do?
If you're going to have surgery,
I'm going to have surgery, Dr. C.
I would say really talk to the surgeon or the urologist who's going to be doing the surgeon, because I think, and Dr. Samadi is part of our A team here, and this is his specialty. And he really feels like the one thing about this study is that it was really done during the learning curve of surgeons when they were just learning this robotic surgery. And so he feels like the numbers are not really fair. He's a little bit concerned about the validity of the questionnaires that they sent patients. So the bottom line is that talk to your urologist. If you have a urologist that has a lot of experience with robotic surgery and they've had good success with it, probably the robotic surgery is a better way to go. And I know in Dr. Samadi's hands, as he says, his patients have less erectile dysfunction and incontinence than those who have open surgery procedures.
I totally agree. I mean, this is not the first time that we have seen a study that goes retrospectively and looks at, number of years and a lot of patients about a new procedure per se. And that's exactly right. When you have a surgical, technique that is being analyzed, that learning curve, I mean, I did it when I was doing certain things for obstetrics. There's a learning curve where you're going to get more complications. And if you include that data, yeah, it's going to be skewed.
Right.
But good. All right, so I'm going to have the
I'm going to have the prostate surgery with Dr. Samadi. If you need another reason to indulge on one of my favorite guilty pleasures, here it is. Chocolate may actually ease pain. You know, the research is saying that chocolate may. I just had Chris. Had Chris here, and I noticed. You know, he made me drink some. You know, here, I'm still chewing on my ginger root here. And he didn't bring any chocolate. What kind of, you know, Chris?
That's right. Dark chocolate's supposed to be good for you.
But anyway, yeah, this is a new study that says chocolate might be good for pain.
Right. This is coming out of the Journal of Neuroscience. And what they did is they fed rats.
It's a rat study.
It's always a rat study.
Of course the rat is going to like the chocolate and is going to do anything you want as long as he gets the chocolate.
I'm assuming these were rodents. But anyway, they fed the rats either a chocolate chip or they gave them a drink of water. Okay, and in both groups, actually, they had a blunted effect to pain, and both groups actually ate more. But you know, supposedly in humans, if you drink water before a meal, you're going to feel more full and you'll eat less. But needless to say, what they found is that eating basically blunts the part of the brain that causes pain, or that you feel pain or sense pain, and actually helps you to, and actually causes you to eat more. So the bottom line is that we probably should not be advocating this study too much, because the last thing we need is to advocate people eating chocolate just to avoid pain.
So don't take 3 M&Ms and call me in the morning, that kind of deal. All right. Well, you know, I'll stick to my little chocolate and wine. You know how much I love that. A little chocolate and wine is always good for the heart and also the spirit. Anyway, as always, Dr. Coomer, thank you so much for joining us. You are the greatest. Thank you for all the good tips. And coming up, a very soulful Manny Plus One that's guaranteed to make you smile. A British university study found listening to your favorite music helps ease pain. Researchers tested a patient's ability to tolerate pain when listening to tunes, and it turned out the patient could endure more. So, for this week's Manny Plus One, I wanted to see for myself. I visited the Elizabeth Seton Pediatric Center in New York City and met a very special girl. Stephanie, they tell me you like music. Is that true?
Yes.
My first impression of 10-year-old Stephanie Gerbeau? She's a child of few words, that is, until we started singing.
I'm in love, ooh, believer, I could leave her if I tried.
Stephanie was born with spina bifida, a malformation of the spinal column that often causes severe nerve damage and infection. She has spent most of her life at the Elizabeth Seton Pediatric Center in New York City because she needed so many surgeries after birth. The hospital staff says they use music therapy as a treatment to elevate moods and ease pain.
A lot of times we see clapping or smiling, or even just opening their eyes or turning their head, which it may not be realized from someone who isn't trained that that's a really strong response, because that child maybe doesn't do that any other time. They only do it when they're hearing music.
This light of mine.
Kenley Mattis does not have a medical degree or a stethoscope, but he's helping heal the sick one song at a time.
I'm in love, ooh, believer, I could leave her if I tried.
When musicians come in the room and all we're doing is we're bringing our joy of playing music and connecting with the patients.
She's a very musical child. I've heard her singing during lots of different things, or listening to music or asking for music during lots of different aspects of her daily care, getting a blood draw, getting whatever medical service that she has to get through.
After playing a concert at Memorial Sloan Kettering Cancer Center in 1999, Kenley and another musician realized the powerful effect their music had on the patients. They formed the nonprofit Musicians on Call and started performing at patients' bedsides.
Patients stop worrying, families maybe stop worrying for a little bit, stop thinking about what specific problems might be going on.
Like Gonzo and his twin brother Jose, many children at the hospital are nonverbal. So the roving musicians are allowing them the opportunity to communicate in another way.
Wonder what you are. That's good, actually.
Now in its 10th year, Musicians on Call is 300 volunteers strong and has worked with some of music's biggest names.
My name is John, and I play guitar and sing.
To bring the gift of song to hospitals in New York City, Philadelphia, Nashville, and Miami.
We have the need all the time in all of our cities for volunteers. So if you're a musician, you can You can volunteer to play in a hospital. If you're not a musician, you can volunteer to guide. You can take the musician from room to room and represent musicians on call.
Ooh, believer, I could leave her if I tried.
Great, you knew all that.
Music can truly make a difference because, as one famous poet once wrote, it washes away from the soul the dust of everyday life. There's no doubt in my mind music has healing powers. In fact, we showed you several alternative therapies here today. But I have to give you one big word of advice. Please talk to your doctor before trying any of them. What works for one person may not work for someone else. And you must make sure these therapies are safe and right for you. As always, check out our website, foxnewshealth.com, for more on today's topic. That's all for now. Thank you so much for joining us. I'm Dr. Manny Alvarez. Until next time, well, I'll still be Dr. Manny, but you might be a little bit healthier.